Hi, myself is Shalini Bharadwaj. You all are watching ITV Networks Medically Speaking. So today we are going to discuss about glaucoma. Glaucoma cannot be cured, but yes, it has treatment that can help you. We have the panel of doctors. We have with us Dr. J.S. Tityal, who is the head and professor of Cornea Services at the Center and chairman of National Eye Bank at All India Institute of Medical Sciences. We have our another guest, that is Dr. Padmashri, Dr. Kumar, who is the director of Glaucoma Services at Center for Sight. We have with us Dr. Viney Gupta, who is a professor of ophthalmology at RP Center at All India Institute of Medical Sciences. So welcome to our panel, sir. My first question goes to Dr. Harsh. Sir, what exactly is glaucoma?
Shalini, should we answer in Hindi, English, or you want a mixture of both the things?
English, sir. But
okay.
English will also work, sir.
No, I'm fine with either of the languages. And first, I must congratulate you on World Women's Day today. So we are seeing where you have reached, and I've seen you struggle from very small to now such a good position. And the second thing is that Dr. Tityal had got the Padmashri before me, so I will just connect that.
So we have two Padmashri doctors, Dr. Padmashri, Dr. Harsh, and Dr. Tityal.
Dr. Viney will soon get the Nobel Prize because
let's hope so and pray.
Okay, now let us start with the seriousness. Yes, what the glaucoma is a dangerous disease in the sense that we call it the silent thief. What happens in glaucoma is it's a group of diseases in which the pressure of the eye rises. And once the pressure of the eye rises, it damages the optic nerve behind. And that is the nerve which actually takes all the vision, collects all the vision from both the eyes and takes it to our brain. And soon, slowly, this nerve starts dying. The biggest problem is that the people do not even realize, and it is not only for our country, which you might think that, okay, we don't have so many literate people. Even in USA, by the time a person realizes that he has glaucoma, 50% of the people have lost 90% of their sight. So it is an extremely dangerous disease. Okay, Shalini.
Sir, it is limited to some age, or it is like, if somebody goes as above 60 years of age, then only person suffers from glaucoma, or it can occur in early stage also?
Well, actually, Dr. Viney is a specialist in children's glaucoma, and he's operating 1 month, 2 month, 2-year-old children also. But commonly, this disease usually afflicts people above 40 years of age, unless it is secondary to somebody putting a steroid in the eye, or there is a trauma in the eye, or there has been some surgery in the eye. So there are secondary causes. But primarily, this affects older generation. And as far as the number is concerned, I must tell you, people will say so many million. But the more important thing to understand is 1 out of every 8 persons, 1 out of 8 who are above 40 are either suffering from glaucoma or they are glaucoma suspects. They may develop glaucoma. So the number is high. And the age is usually that's why we tell everybody above 40 that please get checked yearly. And luckily now we have so many corporate checkups and all, and so we are able to detect more people.
Dr. Viney Gupta, as you are seeing, 1 year, 2-year-old children, sir, is it a congenital disorder also? Prenatal, something is linked to it?
Yes, there are many children, at least in our country, who develop glaucoma at birth or soon after birth, within a year or so. So they are called neonatal glaucomas when they are born with glaucoma, or they are called infantile glaucomas when glaucoma happens at 3 months or 4 months of age. So these children can be picked up very early because they have got large eyes, large looking eyes. They have watering of their eyes. Their parents also say sometimes that there is a whitish opacity in the eyes. So they are able, so therefore the parents themselves come to know. But if the doctor who has delivered the child can open the eyes and see the child, then they can refer these children early to the specialist. Although they are rare, not so common, but out of every 3,000 children born, at least one or two will have congenital glaucoma in our country. So therefore, it is important that we should be able to detect it early and treat it early and prevent blindness in these children. So not only in children, it can also occur in the juvenile adolescent age group. That means 14, 15-year-olds can develop it, or 20, 30-year-olds can develop it, and that is called juvenile glaucoma. So both of these kinds are primary glaucomas. Both of them have got some hereditary component to it. And the ideal thing is to be able to pick them up early and treat them early.
So it can be said the treatment can help, but it can be cured in young age. It has cure.
Actually, generally, glaucoma does not have a permanent cure. The treatment continues lifelong. So therefore, if a child is born, he has to be continuously monitored. You cannot stop the disease and you cannot reverse it. So whatever has happened, you can bring the pressure down, but then after some time, the pressure can go up again, which means that the patient has to be monitored all through their lives.
Dr. Tityal, sir, as I got to know earlier also that, there are a lot of studies and research is also going, especially in AIIMS, that is related to like stem cells. Sir, the research. Do you think, in future, if we do some kind of research related to stem cells, so can we able to treat or, cure it properly, fully, we can cure it?
As far as glaucoma is concerned, I don't think stem cell research is going to help. Currently, the situation is because as Dr. Harsh and Dr. Viney was talking about, the damage is to the optic nerve, which is a nervous tissue, nerve-related tissue. And regeneration of nervous tissue is going to be one of the toughest thing possible in future also. So just now, stem cell research may not help in these cases. Yes, future is definitely there. If not stem cell, genetic studies and some sort of gene therapy might be a better option for these glaucoma patients, especially the congenital variety.
Sir, in other countries, are they doing some kind of, gene therapies or something like that?
I think, Dr. Vinay can answer this particular part of question, and because he is one person who is doing a lot of research in glaucoma field. So I request Vinay if he has some answer on this.
Dr. Vinay,
Yes,
sir, in other countries, are they doing some kind of gene therapies or they are doing some kind of studies or research work?
yes. So basically, they have done gene therapy in animal models. So those genes where it is known that this gene can cause glaucoma, they first induce that mutation in the animal, and then they correct the mutation through gene therapy in the animal model. So at least in the animal model, they have been able to successfully induce a cure through gene therapy. But whether this can also lead to a human gene therapy trials, obviously it is going to take a very long time. So at the moment, yes, in the animal model it has been achieved, and hopefully they are trying that they could be able to correct the abnormal genes in humans at a later stage.
Sir, are we doing such trials in AIIMS also?
Well, currently not yet. Not yet. We have not done any such trials in AIIMS because first we have to establish animal models and do these therapies in animals, and then probably later on at some point of time when we are confident enough, then we could look for. The other thing important is for gene therapy, you have to identify the genes that are responsible for the disease. And in glaucoma, only 30% of the cases have known genes. In the rest of the 70%, we don't even know what is the gene that is causing the disease. So unless we identify the genes, we cannot correct the disease.
Dr. Harsh, sir, what causes glaucoma basically?
So, Shalini, first, I would just like to digress a little bit from the question. I just want to tell this, and I think both my friends would agree on this, that a lot of people in our country are misusing this stem cell therapy, where actually at this current status, as you have already heard from both of them, nothing is available. So I just want to warn the people that if somebody is promising you a stem cell therapy and so that something good will come out of it, I don't think that is likely to happen. So please let them know that
That's
this is
very
not.
important, sir, because we have stem cell banks also, you know.
Yeah, at least for the eye part as of now, I don't think there is any current therapy available, and a lot of people are doing it. Oh, and the most of the people who are caught are those who are already blind or they pretty much can't see anything, and they are willing to shell out any amount of money. So I
That's true.
really want to warn them that please be careful. This is not something which is. I think anything like that somebody suggests to you should go to AIIMS and make sure that what that person is saying is right or not.
I
So
heard
what
it,
was
sir. That is why I asked.
right, right? No, that's very relevant. I think Shalini, that this kind of message must go out clearly to the public so that they are not fooled by people who are more like con men than doctors. So what was the question, Shalini? The one I'm sorry
What
I got.
basically, sir, what causes glaucoma?
Okay, so basically, like Dr. Vinay was telling you, that there is a genetic problem over there, so that normally what happens in the eye, there is an area from which the water is made, which we call aqueous, which percolates through the whole eye, and then it goes out of small holes. Now, due to certain genetic modification, these holes keep closing. So by the age of 40, 45, 50, these holes become less and less open and the water starts collecting in the eye. And then this causes pressure on the optic nerve. Now, the same damage to these holes which are going out can be because of surgery or because of trauma, like I told you, or it could be also because of the use of steroids, which is very, very common. And we must highlight again that please, all of us see people, children who are gone blind because what is happening? They have a slight allergy. There is a lot of redness.
Hmm.
Parents are very bothered. He is always, their eyes are red. It is watering. What is this happening? They go to a doctor. He prescribes them steroids for a very short time. But now what happens? The allergy becomes okay. The parents go back. Next time they don't want to spend the money to go to the doctor. They start putting the same drop of steroids again. And they keep putting the drop. And by the time they realize what is happening, it is too late. So please, with folded hands, I want to request the public, do not put any eye drops in your or your children's eyes for long time, not more than for 2 to 3 weeks before you contact a doctor and make sure that you are putting the thing which is required. So these are some of the reasons by which glaucoma develops.
Sir, some people use gulab jal. What you would like to say about it? They feel itchiness or redness. They feel like, you know, if they will get a drops of gulab jal, then it can be treated. They have such you know, these kind of myths in their mind.
Right, Shalini. So the problem is that actually they are Ayurvedic preparations. And now there's a very, very common thing, drishti. Every alternate patient is asking me, sir, can we put drishti? Now, I think maybe Tityal can, Dr. Professor Tityal can guide us whether they have done any research in AIIMS regarding these common drops. But when I was also at AIIMS long time back, some of these drops which are supposed to prevent cataract, we did a couple of studies and we realized they were totally useless. So I can tell you about those, but neither gulab jal nor eye tone nor drishti have been tested by me at least. So I will request Professor Tityal whether they have done it already, and if they have not done it, I would really request him that they should do it so that we can guide the public.
Dr.
Professor
Tityal, what
Tityal?
you would like to say about it, sir?
I think the point is well taken. These drops are very popular in general community or in societies, because people propagate these medication to be treating everything possible in the human eye, which is not exactly true. We have not done testing for these medication at all. Given opportunity, yes, we would like to test the authenticity of these drops to cure various disorder in the eye, right from a refractive error to cataract, to name anything in glaucoma also. But as far as glaucoma is concerned, these drops are not at all going to be useful. Gulab gel is very commonly used by people, and if it is used for for like a artificial tear, it may be all right if it is freshly prepared. What happens? These people keep these uh, preparation for a very very long time, and they get infected itself, and that can cause infection, sometimes allergies, and it can cause a serious eye damage also. So unless people know that for what purpose these medication has been prescribed by a general practitioners, I'm pretty sure no ophthalmologist will prescribe these medications knowing that they don't have any effect in the eye. So yes, definitely, if people say these medication have an effect, we would definitely like to test in future, especially drishti, which is being propagated to cure everything possible in the eye. And there has been no such research to prove that also. So if people say that they should have a research to prove that it's really effective.
Dr. Vinay, sir, have you seen such case studies in your OPD? That parents are using such drops for their children, because if I would say that almost 95%, except medical professionals, most of the cases parents use such drops. And if I talk about myself also, in childhood, I also used to get these eye drops if I am feeling itchy. So it's a very something which is very suspicious, that we don't have any research and people are using such drops from so long.
Yeah, I mean, such drops which are available over the counter, one has to be very careful. I mean, if you're using them once or twice, it's okay. But if you're using them for long periods of time, then obviously there could be problems. But apart from these drops, there are other drops also, like steroid drops. They are also available over the counter. So when the eye is extremely itchy, some parents just go to the pharmacist and get steroid drops for their children.
There
You know,
are
the
some
pharmacist.
kind of, sir, capsules also, as much as I remember, which are easily available over the counter.
Yeah, there used to be. I mean, there used to be tetracycline ointment that used to come in the capsule form. So those were also used earlier. So I mean, there in India, a lot of drugs are available over the counter. So it is very easy for the parents to go and then buy them because they're cheap also, and then put them in their child's eye. Once or twice is okay, but if they continue to do it for a long period, especially if they are steroids, then they can cause glaucoma. And as Dr. Harsh said, if it happens in a child, it is very difficult sometimes to cure this glaucoma, and the child can go blind. And we see many, many such children who have gone blind because in both eyes actually, and just because the parents were not careful, the pharmacist was not careful. Sometimes the ophthalmologist gave the drops and the parents kept putting it again and again without consulting him again. So all of these things one has to be very careful. I mean, one should consult an ophthalmologist, a qualified ophthalmologist, before one puts any drops in their child's eyes, basically.
Dr. Hart, sir, what are the symptoms of glaucoma?
Now, this is the most tricky thing because, like we said, that glaucoma cannot be easily detected and the person doesn't realize because there are hardly any symptoms. So, there are two types of glaucoma: angle closure and open angle. So, in angle closure glaucoma, the patient actually gets an attack in which there is a lot of redness, pain, watering, and he rushes to the doctor. So, he is caught. But unfortunately, even now, angle closures, most of them are presenting in the silent way. So, what basically happens is that the pressure starts going up and we do not realize at all. But what you should be careful about is that if you were able to see something in the night and now you're not able to see that clearly, if your distant vision is getting blurred, if you are getting headaches, if in the evening you see colored halos around bulbs, and if a very important thing is that if you are at after 40 years of age, everybody gets near vision correction. So they'll get plus zero point 0.5 spectacles for reading purpose. Now, what happens in glaucoma is that this number changes very, very fast. So for a normal person, he from plus zero point 0.5, he'll go to plus 1 after say maybe 2 years, 3 years. But this person, he'll be shocked and he says, what is happening? Every 6 months, every 3 months, 6 months, I'm changing my reading glasses to higher numbers. So this is another very small thing that can be caught, and early glaucoma can be caught. And yes, when glaucoma becomes more advanced, the people will come in with what complaints? That a car hit me from the side, I didn't see it. Or when I'm driving, there's an area which I can't see at all because your tunnel, your field of vision, the the फैलाव of नजर, जो तुम पूरी नजर तुम्हारी जो फैलाव है वो कम होके सिकुड़ जाता है. So you end up with a tunnel vision, and that's too late a stage.
Sir, what is the latest technology which is available for the treatment of this problem?
Well, the latest technology, obviously, we have, unfortunately, we don't have many surgical procedures they have come up, but not many of them are successful. But the lucky part is that a lot of new medications are coming up. And that is why the number of surgeries actually have gone down drastically all over the world. So newer and newer molecules of drugs are now available. There was a time when only two drugs like pilocarpine and beta blockers were available to us in the country. And we are lucky that I must congratulate the government of India that they have really made available test medication which is available anywhere in the world is also available in India. And that definitely is an advancement. But as far as yes, surgically, there are many, many new things which are coming up, like minimally invasive glaucoma surgery, stents, valves, and we all are doing all three. We all are doing those things. But then they are for very, very advanced situations. But for the common man, yes, the newer drugs are a big hope.
That's really good, sir. Dr. Vinay, sir, I was reading one article today that there is a new mobile app can help people diagnose with glaucoma. What you would like to say about it? These apps which are available.
Yeah, so these apps actually you just enter your data, you enter it's like a risk calculator. So it will give you what is your risk of developing glaucoma. So if you put your information, but a lot of this information has to be put by the doctor because it includes things like pressure of your eye. It includes the corneal thickness. It includes what degree of myopia you have. So actually, the patient cannot do this. I mean, this information he has to get from his doctor, and then he can put this information, and then it is going to tell that particular person what is his risk of developing glaucoma. Another important thing that is missed out is the family history. Especially those who have a family history of glaucoma have to be very careful because the incidence of glaucoma is almost 10 times higher in those who have a family history of glaucoma. So it's a very good thing to screen other members and to inform the other members of the family that you have glaucoma and therefore you need to see an ophthalmologist, an eye specialist.
Oh, that's really good. Dr. Tityal, sir, I just got to know that, some specialists are saying that around 1.2 crore people in India are affected by glaucoma and approx 5 lakh patients are from Telangana. Sir, what can be the reason that, a particular state is getting so many patients? What can be the reason behind it?
It depends, where the study has been done. Till date, we don't have the entirety of knowing the effect of glaucoma or prevalence of this disease in the country, because very difficult to do survey of glaucoma per se. Very difficult to really conduct community-based studies. I understand Andhra Pradesh is one state, or Telangana now, where they would have done some studies in the community and they have come out with this report. But important thing here to understand, if you look into blindness, the glaucoma related blindness may not be prominent in terms of blindness. But if you look into disease per se, it will be very common in the community, as both Dr. Harsh and Vinay was talking about.
Mhm.
And more importantly, in our country, there's a lot of myth behind glaucoma and cataract, because they happen to be, almost similar age group where people suffer from a decreased vision, which may be because of cataract or maybe because of glaucoma also. So it is very important for us to make sure that patient doesn't have glaucoma, because glaucoma is a disease which is like a diabetes or a hypertension, which is not going to go off from your body. So you are patient of glaucoma, you remain patient for glaucoma in treatment also. It's a lifelong treatment and lifelong follow-up with a particular doctor, hospital, or institution that people have to understand. So there is a definite need of doing a good survey for the country so that we realize what is the prevalence, incidence of glaucoma in the various types of glaucoma in a community, and what is the actual blindness related to a glaucoma per se. And more importantly, I think the rehabilitation and treatment part has to be initiated accordingly. Because once people get blind, it is an irreversible damage. In fact, if you look into a stats, this is the one of the most common cause of irreversible blindness. Other blindness can be reversed by surgeries and other things, but here, once you get glaucoma blindness, nothing can be done. So there is a very important prophylaxis in terms of doing a social community-based studies that look for a preventable aspect to check disease onset in the right in the initial stage so that they don't go into blindness. So that's a difficult task, but I am sure we'll be able to do it in future, do studies to cover the entire country, if not all the districts, and take some important districts. A recent study by NPCB, which came out in 2019, glaucoma is, I think, third leading cause of blindness in our country. So that's a significant amount. So I definitely see other states. It's not that we don't have glaucoma in the eastern part or the northern part. We do have, and definitely we require community-based studies.
That's very important, sir. Dr. Hertz, sir, during COVID-19, how much patients have been suffered, especially glaucoma patients, these patients who cannot visit doctor timely? Have you seen such patients?
Yes. Shalini, I think this is a very, very important question you have raised. And we are actually very shocked at what we are seeing. It was so unfortunate that whole lot of people could not visit us. Some of them even could not get the proper medications.
Hmm.
And because of that, their pressures were not checked.
Hmm.
And so many patients, as a matter of fact, it's difficult to even tell the number, but almost every patient coming to us who had a good field of vision we suddenly see that there is a major drop of field in the vision, and we feel so horrible about it. So really, I think that's a very relevant point you have raised. So what, and they were so scared because most of them were elderly.
Hmm.
So obviously, the first thing was to save their life rather than the sight. And so one thing from this point, I would like to say is that yes, please stock your medicines for adequate time, because we are seeing now what is happening. So most of the drugs have an expiry of 1 to 2 years. So if something like that, a lockdown goes on for 3 months or something like that, at least you should be well prepared. And please, for God's sake, the glaucoma patient should never stop their medications at all. So because once you are under stress, you are this thing, the pressure sometimes tend to rise. If your BP rises, your stress rises. And that has happened in COVID all the time. So was very important and very relevant question. Just one point, because I think Vinay was very right, we missed out a slide because the questions were like that. Let me just reiterate this point, that who are the people who are likely, if they ask us, sir, who are the people who are likely to get glaucoma, then number one, like Vinay said, is the person who has a family history of glaucoma. The others are those who are diabetics, hypertensives, thyroid disease, those who have myopia. Okay, so high myopia. So these are all people who are more prone to get glaucoma as compared to a normal person, and they should go, especially if it is in the family. Every